Okay, so my name is Dominic Garcia. I'm going to be performing a newborn physical assessment, and I will go ahead and begin with APGAR. So I'm going to go ahead and listen to the patient's pulse. Okay, so the patient's pulse is 135 beats per minute. The appearance is acrocyanosis, which is the red of the trunk of the body as well as the head and the blue extremities. The patient also shows grimace upon birth while crying. The patient has flexed extremities and the respirations are 45 breaths per minute. So now I'm going to go ahead and move on to the temperature, which is right here. I'm going to take an auxiliary. Okay, so the temperature is 98.7, and the patient does not appear to be in any pain upon crying. I'm going to go ahead and weigh the patient. Okay, the patient is 7 pounds, 8 ounces, and I'm going to go ahead and measure the patient as well. Okay, so the patient is 20 inches long. The skin color appears to be within acrocyanosis, which is appearance, but it appears to be within ethnicity. The texture is smooth. The skin turgor recoils immediately. The patient does have some languigo on the upper forehead towards the side of the eyebrows, as well as on the patient's back, running down the side of the arms towards the triceps. The patient does not appear to have any rashes. However, the patient does have a Mongolian spot on the buttocks, which is very common. The patient does have some vernix cyanosis all around the body. However, the hands and the feet ones are peeling. The hands and feet are peeling off. So now I'm going to go ahead and begin with the reflexes. I'm going to start with the blink reflex and also assess the pupillary reflex after. Okay, so the patient does blink and the patient's pupillary reflex is constricted. So now I'm going to go ahead and start with the startle. Okay, so the patient does get startled, which indicates that these reflexes are intact. I'm going to go ahead and begin with brooding. Okay, so the patient will go ahead and turn whichever side of cheek I'm stroking. Okay, so the patient does respond. I'm going to go ahead and assess the sucking reflex, which appears to be adequate. And I'm also going to assess the soft and hard palate, which are intact. I'm going to do the palmar grasp. Okay, for the left hand, the baby's fingers do curl up. The right hand as well. I'm going to go ahead and do the plantar grasp. Okay, the fingers do curl up. I'm going to do the other side. Okay, both the right and left both respond. So I'm going to go ahead and do the stepping. Okay, so the patient does react by putting its feet flat on the bed. The Babinski, I'm going to go ahead and assess that. Okay, so the toes do flare out on the left foot. I'm going to try the right one. The right one does flare out as well, indicating this indicates that it's a good finding. I'm going to go ahead and assess the neck, the tonic neck reflex. So I'm going to go ahead and turn the baby's neck, and whichever side his neck turns, his extremities are supposed to move to. Okay. Okay, so now I'm going to go ahead and assess the prone crawl. When I put the baby on the stomach, the baby will go ahead and use their back legs to crawl. And he did. So the trunk in curvature is flat. So the head appears to be round, symmetrical, and soft. The circumference, let me go ahead and measure the baby's head. I will measure it from the occipital to the, around the head to the above the eyebrows. Okay, so it's within normal limit range. I'm going to go ahead and assess to see if there's any molding. And there appears to be some molding, which is the overlapping of the cranial bones. However, this is a normal finding. And I will go ahead and assess if there is the fontanelles. So they are soft. And the patient does not have a cephalohematoma, however, does have a captic which is a accumulation of fluid. However, this should go ahead and be absorbed into the body within 12 hours. I'm going to go ahead and assess the face, which appears to be symmetrical. The outer eye appears to be aligned with the tip of the ear, as well as the tip of the nose to the outer canthus of the ear. The patient does have some forceps marks, as the mother did have a vaginal birth with some assistance from the forceps. He does have them on the cheek, and they're red, so they're right below the eyes, on the cheekbone area. The patient does have some milia as well on the bridge of the nose. However, this is normal and we're not supposed to pop them, so I'm going to go ahead and leave it. So the patient's mouth is symmetrical upon movement, and he has a strong free movable tongue. And again, the hard and soft palate are intact, indicating no cleft lip. So I'm going to go ahead and examine the external ears, which appear to be symmetrical with each other. The pigmentation appears to be evenly distributed throughout the body, as well as the ears. There appears to be no lesions or no trauma. The patient does respond to hearing by turning his head anytime he hears his mother talking. So the patient's eyes are blue. They are bright and clear. The coordination, the patient does have a slight astigmatism, which is common with newborns. The eyelids are right above the pupil, but not covering the iris. And this indicates no drooping. So the patient's cornea is clear as well. The sclera is white. I'm going to go ahead and check the conjunctiva, which is red. The pupils are equal and reactive to light. And the lashes are evenly distributed upon the top eyelid, and on the bottom. Eyelashes are distributed equally. So the patient's neck, he does appear to have some skin folds posteriorly in the back. However, this is common, and the clavicles are equal and equally symmetrical, as well as aligned with the shoulders. There's no breaks, and it's intact. The patient's chest circumference, so I'm going to go ahead and measure this. I'm going to go ahead and put it on the back of him, and I'm going to go ahead and measure it right above the breast of the patient. Okay, so within normal range. The umbilicus, there appears to be I'm gonna go back to the breast buds are present, and no use of accessory muscles. The heart, I'm gonna go ahead and listen to the heart to see if there's any murmurs or thrills. Okay, so the patient does have a slight murmur, however, no thrills are present. I'm going to go ahead and assess the abdomen. I'm going to go ahead and put it on the back of his back, and I'm going to measure it to the highest point of the belly. And this is within normal limits as well. Okay, so the appearance, again, he does have acrocyanosis, so reddening of the trunk, so the abdomen is red. The umbilicus has no protrusion. It is a bluish white color, and there is no bleeding. Okay, so the extremities, the arms are equal in length and intact, no lesions, as well as the legs equal in length, no trauma, no lesions, no broken bones. The feet have 5 toes, and are in a straight line for the feet, as well as the hands. The hands have 5 fingers and is within normal limits. So the patient does not have any presence of jaundice. The patient did have a bowel movement. It was a black tarry bowel movement. I believe you say it as mechanom. Can't say that word. The urine is clear, yellow, and with a mild odor. The patient is a male, so I'm going to do the assessment for the the genital assessment for the male portion. So the patient's penis, his foreskin is adhered to the glands. He is uncircumcised. The scrotum is tight and small. The skin color is within ethnicity, and the testes have descended from birth. I'm just gonna go ahead and put my hand on top of the pelvis, and I'm gonna go ahead and push him down. Okay. So the patient's buttocks, I'm gonna go ahead and assess that. So the patient's buttocks is symmetrical and midline. There appears to be no lesions. However, I did mention that the Magnolian spot is present, and this should go ahead and disappear within time. And the patient's cry is strong with a moderate tone for pitch. Okay, and this completes my newborn physical assessment.